Welcome back to another episode of Let's Talk Wellness Now. And I'm your host, Dr. Deb. And today we're pulling back the curtain on a topic that barely gets a whisper in conventional medicine: chronic bladder symptoms, biofilms, and the hidden genetic drivers that keep so many women stuck in a cycle of pain, urgency, and infection that never truly resolves. My guest today is someone who is not only brilliant, but battle tested like myself. Dr. Kristin Reihman is a physician, a mom, and the author of Life After Lyme, a book and blueprint that has helped countless people reclaim health after complex chronic illness. After healing herself from advanced Lyme, she has spent her career helping patients recover their most vibrant, resilient selves through her Inner Flow program, her Healing Grove podcast, her membership community, and her deep dive work on bladder biofilms and stealth pathogens. And what I love about Kristin is that she teaches from lived experience. In 2022, she suffered a stroke and not only survived it, but rebuilt her brain, resolved lateral strabismus, restored balance, and regained her ability to multitask. That journey uncovered her own genetic predisposition to clotting, the very same patterns she sees in her chronic bladder patients. And that personal revelation ultimately led to her introducing this groundbreaking work that we're talking about today. So let's get into it, because bladder biofilms, clotting genetics, stealth pathogens, and real recovery is the conversation women have been needing for decades. Welcome back to Let's Talk Wellness Now. I have Dr. Kristin with me, and I am so excited to talk to her for multiple reasons. A, she's got a fabulous story, and B, she's an expert in a topic that nobody's talking about. And I want to learn from her too. So welcome to the show.
Thank you. I'm so happy to be here, Dr. Deb.
Thank you. Well, let's dive right in because we have so much to talk about, and you and I could probably talk for hours. So let's dive into this conversation and tell us a little bit about yourself and how you got involved in this.
Well, I mean, like so many people, I think on this path, I had to learn it the hard way. I had to find my way into a mystery illness, a complex, mysterious set of symptoms that sort of didn't fit the sort of description of what, normal doctors do. And even though I was a normal doctor for many years, nothing I'd been trained in could help me when I was really debilitated from Lyme disease back in 2011, 2012, 2013. And so I kind of had to crawl my way out of that using all the resources at my disposal, which, started out with a lot of ILADS stuff, a lot of the International Lyme and Associated Diseases Society resources online, found some Lyme doctors. And then my journey really quickly evolved to sort of like way far afield of normal Western medicine, which is what my training is in. I think within a year of my diagnosis, I was like, at a Klinghardt conference and learning all sort of, the naturopathic approach to Lyme and really trying to heal my body and terrain and heal the process that had led me to become so ill, a little bacteria.
Yeah, same here. Like, I've been an ILADS practitioner for over 20 years. And when I got sick with Lyme, how did I not realize this? And I knew I had Lyme before I even was ILADS trained. But when I got really sick and got diagnosed with MS, I never thought about Lyme or mycotoxins or any of that because I was too busy, head down, doing what I'm doing, helping people. And I too had to take that step back, not just physically, but more spiritually and emotionally, and say, how did my body get this sick? Like, what was I doing and what was I not doing that allowed this to happen? And now look at this from a healing aspect of not just the physical side, but that spiritual, emotional side as well.
Totally. I have the same realization as I was coming out of it. I was like, wow, this wasn't just about sort of physically what I was doing and not doing. There was something spiritual here as well for me. And I feel like it really was a wake-up call for me to get on the path that I'm supposed to be on, the path that I'm on now, really, which is stepping away from the whole medicine matrix model and moving into, working with really complex people, listening to their bodies, understanding intuition, understanding energy, understanding all these different pieces that doctors just aren't trained to look at.
Right? We don't have time to learn everything, right? You have time to learn the body and the medical side of things, and that's a whole prism of itself. But then learning this spiritual energy medicine, that's a completely different paradigm. That's a full-time learning aspect, and it's so different than what we learn in conventional medicine.
Yeah, Yeah, it's a complete health system. Like it's a complete
Yes.
healthcare system.
Yes. And nobody takes it that seriously, but myself, I've been spiritual healing for decades. And it wasn't until I got really sick that I dived deeper into that and looked what is it in this world that I'm owning, what belongs to generational things that were brought to me from childbirth and other generations in my family that I'm carrying their old wounds. And how do I clear some of that so that it's not still following me? And then how do I help my kids so that they don't have to carry what I brought forth? And it's just a lot of people that may sound crazy, but that's the kind of stuff that we need to be looking at if we want to truly heal.
Yeah, and I think it's also it's inspiring, because when people and I would tell this to my patients with Lyme and these sort of mystery illnesses, like, look, you are on this path for a reason, and this is going to teach you so much that you didn't necessarily want to learn, but you need to learn. Nothing that you learn or change about your lifestyle or the way in which you move through the world is going to make you a worse person. Like it's only going to sort of up-level you, going to up-level your diet and your sleep habits and your relationships and your toxic thinking. Like it's all going to change for you to get better, and that's a gift.
It really is. And I tell people the same thing. Like we can look at this something that's happening to us, or we can look at this as something that's happening for us. And that's how I looked at my MS diagnosis. This was happening for me, not to me. I wasn't going to be the victim. And you have a very similar story. So tell us a little bit about your story and what kind of catapulted you into this in 2022.
Well, by 2022, I was like 10 years out of my Lyme hole, and I had been seeing patients. I opened my own practice, and I was working for another company seeing families who have brain injured children. I was their medical director, still am actually. And so I was doing a patchwork of things, all of which really fed my soul, all of which felt like this is like me aligned with my purpose on the planet. And so based on a lot of my thinking, I sort of figured, okay, well, I'm good now. Like I'm on my path now. Like the universe is not going to send another 2x4. And then the universe sent another 2x4. And in 2022, I had an elective neck surgery. Kind of still see the little scar here from my 2-level ACDF because I had crazy off the hook arm pain for like a year and a half that I just finally became like almost like it felt like I was developing fasciculations and fiery pain. And I just got the surgery and pain went away. But when I woke up, I was different. I didn't have a voice, which is a common side effect actually of that surgery that resolves after a few months, and in many cases, and mine did. But I also didn't have normal balance anymore, and my right eye turned out a little bit, and I couldn't multitask. And my job is all about multitasking. As you know, with very complex people in front of you, you're hearing all these pieces of their story and you're kind of categorizing it and thinking about where they fit, and you're making a plan for what to work up and you're making a plan for what to wait on till the next time. It's like all these pieces, right? You're in the matrix. I couldn't hold those pieces anymore. And I didn't realize that until I went back to work a couple months after my surgery. And because my voice came back and I was like, okay, well, now I'm going back to work. And then I realized I can't do simple math. In fact, I can't remember what this person just said to me unless I read my note. And I can't remember taking that note. What is going on? And so I had a full workup. And indeed, I had some neurological deficits that didn't show up on an MRI. So they must have been quite tiny. Possibly were even low flow, episodes during my surgery when my blood pressure drops really low with the medicines that you're on for surgery. But I basically had like a few mini strokes and needed to recover from that. So that was sort of that was the 2x4 in 2022.
Wow. So what are some of the things that you learned during that process of that mini stroke?
Well, the first thing I learned is that something that I already knew from working with the Family Hope Center, which is that organization I mentioned that helps families heal their kids' brains. I know that motivation lives in the pons. And if you have a ding or a hit to the pons, like you don't want to get out of bed in the morning. You don't want to do the work it takes to heal your brain, in my case. And I remember spending several months in the fall of 2022, just sort of walking around my yard with my puppies being like, this is enough. I don't really need to work anymore, right? Like, why do I need my brain back? Like, I don't need to have my brain back. I'll have a garden. I have people I love and who love me. Like, why do I need to work? Like my whole like passion, purpose-driven mentality and motivation to kind of do and be all the things I always strive to do and be in the world was like gone. It was really interesting / very alarming to those who knew me. But being inside the brain that wasn't really working, it wasn't alarming to me. I was just sort of like, oh this is my new me. Well, luckily I have some people around me. I like to call them my healing team, who sort of held up a mirror and they're like, this is not you. and we're going to take you to a functional neurologist now. And so I ended up seeing a functional neurologist who, within probably 6 visits, I had all these like stacked visits with him. Within 6 visits, my brain just turned on. I was like, right, I need my brain back. I got to
Mhm.
fix this eyesight. I got to get my balance back, and I got to learn how to do simple math again and multitask. After that sort of jumpstart, I actually did the program that I, know very well inside and out from the Family Hope Center, where I'd been
Mhm.
medical director for 10 years. And it's a hard program. It's not for wimps. And it's certainly, I wasn't about to do it when I had no motivation. So I'm really grateful to the functional neurologist who helped me kind of like get my pawns back and my motivation back, my mojo. And then I'm really grateful to the Family Hope Center, because if I didn't have that set of tools in my back pocket, I would still have an eye that turns out to the side. I would still have a positive Romberg, closing my eyes, falling over backwards. And I would still have a lot of trouble seeing patients and probably wouldn't be working anymore.
I can totally relate to that. When I got my MS diagnosis, there's a period of time where you go, okay, reality kicks in, and I'm thinking, okay, how long am I going to be able to work? How long am I going to be able to play with my kids and my grandkids and be able to be me? And I started looking at, how do I sell my practice just in case I need to do this? How do I step back? And I spent probably about 9 or 10 months in that place of, this is going to be my life and it's not going to be what I'm used to. And, how are we going to redesign my house and do this and that? And finally, my husband looked at me one day and he's like, what the hell is wrong with you? And I was like, what are you talking about? He's like, this is ridiculous. He's like, you fix everybody else. He's like, you can fix yourself. Why do you think you can't fix yourself, or you don't know the people that can fix you? You need to get out of this and pick yourself up and start doing what you tell your patients. And I sat there, and at first I was like, doesn't he know that I'm sick? Like, I have MS. I took that victim mode for a little bit, and then I went, no, he's right. Like, this is my wake up call to say, I can reverse this, I can fix this. And total turnaround too. Like, I started reaching out to my friends and colleagues because I kept myself in this huge bubble. Like, I didn't want anyone to know what was going on with me because I was afraid my patients wouldn't see me. What are my staff going to say? My staff are going to leave. And if I lose my business, what am I going to do? And da, 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 all those fears. And then when I finally started opening up and sharing with people, people started bringing me other people, and you need to talk to this person. You need to talk to this person. They connected me here and there and this place. And 18 months later, I was totally back to normal again. And now my practice is growing and we're adding on and it's bigger and I'm taking on more projects than I feel like myself. And I was a lot like you too. Like, I couldn't remember my protocols that I've done for 20 years. I had to depend on what was in the EHR to pull forward because I always had them in my notes. So I didn't have to type them all the time. But I was like, I have to pull that forward because I don't remember the name of the supplement that I've used for 15 years. I don't remember what labs I'm ordering. I don't remember the normal values of this stuff. And now it's back on the tip of my tongue, but at the time it was a little scary for sure.
Yeah, it's so scary. Well, that's a remarkable story, and why I can't wait to have you on my podcast. But I'm really happy that you had a healing team around you too, who was like, yeah, nope, that's not the train we're on. Get off that train. Come back on your usual train. What are you doing
Yep.
over there?
Yeah. And I hope that a lot of patients have that, or people that are experiencing this have that, but there's so many people who don't have that. And they need somebody in their corner, like we had in our corners, to help pick them up and say, this doesn't have to be your
Yeah.
reality. It can change, but it is a lot of work. Like you said, it's a lot of work. It's
Yeah.
not.
Yeah, no, it's a lot of work. So when I started off, I was doing probably 4 hours a morning, like basically my entire morning was devoted to brain training and healing my brain through I mean, I can get into the details of it, but basically it's a lot of like crawling on the floor,
Mhm.
on your belly, creeping on your hands and knees, doing reflex bags to stimulate, more blood flow to the brain, doing a lot of smells, and just staying with it, And I remember balking even in the beginning. I was like seeing some changes. I was feeling more motivated. I remember feeling this. Started noticing it was changing about 2 weeks in, when I would get up in the morning and I noticed I would do my like beginnings of the day. I would get the kids on the bus. I would do everyone's breakfast. I'd do the dishes, and I'd be like sitting down and being like, like, what am I supposed to be doing now? Like, what is my purpose today? And because I had this plan, I would just be like, well, I know that has to happen, so I may as well do that now. And I would get on the floor and I would start crawling down the length of our hallway. And within about 8 laps, I would feel my brain like I felt like it integrating. I would feel things like just coming online, and I'd be like, oh, right. I know who I am. I know what I'm doing today. I have these other things this afternoon. I got to get this done before noon, and I would do it. But it was really interesting, and I've never been a coffee drinker, but when I thought of what that felt like, to me,
Mhm.
that's how people often describe like my brain doesn't wake up till I have coffee. I'd never needed coffee to have my brain woke up before I'd wake up, and I'd be like, bing, and I'm ready to go. But when
Yeah.
I had the brain injury for those 9 months, it wasn't that way the whole time. In the beginning, it was very hard to get my brain back in the morning, and it was creeping and crawling that would pull it in.
Wow.
Yeah.
Is there one particular thing that you did that you felt made the biggest difference to rebuilding your brain?
Crawling on my belly like a commando, wearing elbow pads, knee pads, actually two sets of knee pads, wearing toe shoes, and just ripping laps on my floor.
Wow. And that's so simple to do. So why does that work?
So interesting. And this is the kind of this is the story of this is something that I think is bigger than all of us. And I wish everybody knew how to optimize your brain using just the simple hallway in your house. But essentially, if you take a newborn baby and you put them on mom's belly and they're neurologically intact, and maybe you've seen videos of this. There used to be a video circulating about a baby born into mom's belly. Nobody touches the baby. And in about 2 minutes and 34 seconds, that baby crawls on its belly, like uses arms, uses its toe dig with its little babinski, and pushes its way up to mom's breast, latches on with its reflexes, and there you go.
Mhm.
That baby keeps itself alive through its primitive reflexes. So it's essentially telling its brain every time it runs those reflexes, every time it does a little toe dig, every time it like swings its arm across in a cross ladder, what do we call homolateral pattern. That little baby is getting a message to its brain that says grow and heal and organize. And because all the reflexes come out of the middle and lower brainstem, that's the
Mhm.
part of the brain that's organizing as a baby. And as a baby grows and does the various things a baby does, using its reflexes, like eventually on its belly, crawling across the floor, and then popping up to hands and knees and creeping across the floor, and eventually standing and walking, all of those things are invoking a different set of reflexes that tell the brain to grow and heal and organize. So it's almost like the function creates the structure. And if you run those pathways again and again and again, your brain will get the message to basically invoke its own neuroplasticity. And that's how a baby's brain grows. And it turns out any brain of any age, if you put it through those same pathways, it will send a message of neuroplasticity to the brain, and the brain will grow and heal and organize.
That was going to be my question is why aren't we using this for elderly people with dementia or Alzheimer's or stroke or Parkinson's or things like that to help them regrow their brain?
Well, because number one, nobody knows about it. Number two, even when people do know about it, nobody likes to be on the floor like a baby, creepy and crawling. And least of all, the stubborn old people with dementia who are like, who don't even think they have a problem. I mean, the problem with the brain not working, as I discovered, and it sounds like you discovered too, is the brain that's not working doesn't know it's not working, or worse, doesn't care. And so it's tricky with adults. With kids who, you have some sort of power over, you can often make your kids do things that they don't want to do, like eat their vegetables or creep and crawl on the floor for 80 laps before they get to
But
go, do their thing. But adults are a little trickier.
Mhm. Is there another way for us to be able to do that same thing without the crawling on the floor? Like, could they do it in a sitting motion, or do they need that whole connection to happen?
Well, they need to be moving in a cross pattern, and they need to be moving their arms and their legs in such a way that stimulates the reflexes. But
Mhm.
you can do that on your bed. You can do it face down on your bed by
Mhm.
getting into a pattern and switching sides and, moving your legs and your arms in the opposite, an opposite cross pattern. Um, and that will get you some of the benefit. And in fact, we work with kids who are paralyzed and who aren't able to independently move forward in a crawling pattern, who have people coordinating their movements so that they get the same movement and the brain registers it, and they do make progress, and some of them eventually crawl and then creep and then walk.
Wow, that's
Yeah.
so cool. And it's so simple and easy for people to do.
Well, it's simple. I don't know that it's easy. I do, I do, having done it myself, I will say it's probably the hardest thing I've ever done was literally crawl my way out of that brain injury.
Mhm.
And I'm so glad that I knew what to do, and I'm so glad I had people push me to remind me that it was important because I'll share another story of my own resistance. So about 2 or 3 weeks into it, I was up to 300 meters of crawling on my belly and 600 meters of creeping on hands and knees, which was really killing my knees, which was why I was wearing 2 knee pads. And I started to get this feeling that maybe I wasn't doing enough. Like, even though I was noticing changes and even though I was feeling more purpose and I was getting organized in the morning, I could tell it was making a difference. I knew, I remembered that usually the kids on our program are doing a lot more than that, including my youngest kids, but I made them creep and crawl, even though they didn't have serious brain injuries. I just thought, we're going to optimize everyone. Get on the floor, get on the floor. So I was nervous about not doing enough. So I reached out to one of the members of the team, and I said, hey, Maria, what do you think about my numbers? And here's a video of me creeping and crawling. What do you think? Am I doing it right? And she said, you're doing it right, but how many meters are you doing? And I said, I'm doing 300 meters of crawling on my belly and 600 meters of creeping. And she's like, oh, yeah, that's not nearly enough for an adult. She's like, Matthew probably gave you those numbers because he felt bad for you and thought you were going to be still working. He didn't know you were going to take off from patients. Now that since you're not working, you need to do more. I was like, okay, tell me how much I'm supposed to do. And she goes, you need 900 meters of crawling on your belly and 3,600 meters, 3.6 kilometers of basically crawling on my hands and knees.
Oh my gosh.
And I just shut down.
Yeah.
I was like, okay, screw it. I'm not doing it.
Mhm.
And I spent a day or two just not doing it and feeling petulant. And then I was like, you know what? Forget that. I was noticing some benefit. I'm going to do my 300, 600. So the next day I went and did 300 and 600 while my daughter was at physical therapy. And we got back in the car and I said, hey, I'm so excited. I finished all my creeping and crawling and it's only 10 a.m. on a Saturday. I'm done for the weekend. And she did this. She's sitting in the car. She looks at me. She goes, was that your whole program or was that a third of your program?
How old is she?
Well, she's like 20 now, but she was 18 at the time and she had my number and I was like, Tula, how can you say that? I'm working so hard. And she's like, Mom, you need to stop seeing patients completely and do what they tell you at the Family Hope Center because we're your family and this is your brain we're talking about and we need you to have all your brain back. And I must have looked terrible because she goes, too much.
You raised a good daughter.
I was a good daughter. And I was like, well, let me ask you, do you mean that? She goes, yeah, I really mean that. I'm like, then it's not too much. I needed to hear that. Thank you. And I went home and I finished another 600 of
Mhm.
crawls. I never got up to 3,600 of creeps. It was just too much for my knees. I got to 900 and 900, but that was the end of my resistance. And I just did it. I just
Mhm.
did it.
Yeah, your family needed you, right? I mean, when somebody in your family that you love tells you they need you, that's a huge motivating factor.
Yeah. Yeah. I'm so grateful for that. So I did that for 9 months. And at the end of 9 months, my eye was straight and stayed straight. My balance was back because I was multitasking again. And I could take, days and days off of creeping and crawling and not notice a dip. I was like, I'm done.
Wow, that's awesome.
Yeah.
During this process, you also discovered that you're part of 20% of the people with clotting genetics. Tell us a little bit about that. What's your understanding in that?
Well, so I'll back up. So before I had my stroke, I had already been seeing patients with really complex, the patients like yours, really complex stories, lots of different things going on, kind of the perfect storm for if they got a tick bite, they tanked.
Mhm.
And I'm one of those people, and my patients were those people. And about 7 years ago, I had one of these patients who said to me, I've never told you this, but when I was in my 20s, I had so many bladder infections, so much like, kind of interstitial cystitis. They said it was, and they said it wasn't an infection, but it felt like one. And I've been doing a little research. And
Mhm.
I've learned about this woman whose name's Ruth Chris. She's a nurse practitioner and she sees patients and she works with practitioners and she basically heals interstitial cystitis and I want you to work with her. I want you to learn from her. And I was
Mhm.
like, I'm game. That sounds really interesting. I have no idea what she's doing. And you don't usually hear the words cure and interstitial cystitis in the same
No.
sentence. So, like, I'm in. So I reached
Mhm.
out to Ruth. And long story short, I've been working with her for the last 5 or 7 years,
Mhm.
basically increasing the number of patients who I'm diagnosing now with these hidden bladder infections that are really often what's at the root of these interstitial cystitis symptoms, meaning you go to the doctor, you pee in a cup, they look for something, they say there's no infection here, so you're probably crazy, or you probably have just a pain syndrome, we can't help you. And actually, if you look with a much more sensitive test, and if you break down the biofilms where these bugs kind of are living in the bladder, you find them and then you can treat them and then people get well. So I knew about this and I didn't have any bladder infections that I knew about. And
Mhm.
what I did start to think about after my stroke was, well, maybe since these people who have these bladder infections often have issues breaking down biofilms, the same genetics that lead you to have trouble breaking down biofilms, which are these places where the bugs are kind of hiding in your body, have trouble breaking down clots. And I just had some strokes. I
Mhm.
wonder if I have maybe some of these clotting genetics that I'm looking for in all my bladder people. And so I looked and surprise, surprise, I had not one, not two, but like six of them.
Oh my gosh.
Ruth said, darling, I don't know how you're standing up. This is more than I've ever seen in any of my patients. And she's been doing this for like 4 years now. I was like, oh boy, that's not good.
Mhm.
But in retrospect, it made a lot of sense to me because having the clotting genetics I have puts me at risk for severe, chronic Lyme that's intractable, which I had. It puts me at risk for trouble with, having surgery and clotting and, low blood pressure and low flow states. It puts me at risk for the cold hands and cold feet that I had my entire life until I started treating the clotting issues by taking an enzyme that breaks down little microclots. I mean, I was the person in med school who'd put my hands on people, be like, I'm so sorry. My
Mhm.
hands are ice, warm heart, cold hands, warm heart.
Mhm.
Um, yeah, not anymore because I've treated it. But yeah, so I was surprised slash not surprised to find that I'm one of the people in my community who is a setup for chronic infections and strokes and bladder infections.
So you just had that predisposition that took you down that path.
Yeah, I think so.
What are some of the layers of biofilm and the stealth pathogens like tick-borne diseases and things like that hiding inside us? That what are some of the symptoms look like? And how do they look different in people with clotting disorders versus the common tick-borne disease?
I would say they're very similar. So it tends to be poor peripheral circulation. So if
Mhm.
you put your hands on your neck and your hands feel cold to your neck, you have a
Mhm.
difference in the heat, right? The amount of blood flow in your sort of axial skeleton and area as compared to the periphery. And that can indicate a biofilm kind of predisposition or a clotting disposition. It doesn't necessarily mean it's there, but it's a clue, right? Another
Mhm.
clue is a family history of any kind of clotting disorders. So miscarriages, heart attacks, especially early heart attacks, strokes,
Mhm.
especially strokes in young people. These things are clues that we should probably look for some kind of clotting issue. And of course, in my population, I'm always thinking about it now because if you have not been able to get well with the usual things for Lyme disease, for example, or Babesia or Bartonella, all of which, by the way, can form biofilms or, love to live and hide in biofilms, then chances are your body's having a hard time addressing those biofilms. And it turns out so the connection between the clotting and the biofilm piece is that the same proteins that our body uses to break down biofilms are used to break down microclots, blood clots, and soluble fibrin, which are the sort of precursors to those clots. And so if we have an issue kind of grinding up those just normal flotsam and jetsam in our blood flow, then our blood flow is going to become sticky and our blood will become sort of stagnant and sludgy. And that's sort of a setup for not being able to heal from infections.
Is one of the genetic markers you look at it MTHFR?
I look at that, but I don't consider that a clotting issue unless it leads to high homocysteine. So homocysteine can be either high or low. They're both problematic. And MTHFR can create either an overmethylation situation. And sometimes if people have low homocysteine, it's almost worse because they're such poor detoxers that they can't actually get anything out of their system and they get sludgy for that reason. But I think in terms of the clotting, the bigger issue is high homocysteine, which, typically the MTHFRs, the 1298 would be more implicated for that.
Yeah, it kind of sets you up in
Yeah.
there.
Yeah.
I'm curious what you're seeing. I know since the pandemic, we see a lot of people with elevated D dimer levels. Are you seeing some of that in your practice too? Like we're seeing more of it. And now that you're talking about this, I'm wondering if some of those people are predisposed to some of these genetic makeups, and that's why we're seeing such a high rise in that. And this is connected, it's a piece we're missing.
Yes, I do think it's a piece we're missing. There was a very interesting study that came out of South Africa. A physician in his office did a clinical study on his patients using 3 blood thinners. So he put people on Plavix and Eliquis and aspirin all at
Mhm.
once. Yeah, you'd be hard pressed to find a doctor in the States to like, kind of risk that because most people don't even want people on aspirin and Plavix at the same time. But he
Mhm.
put them on 3 different blood thinners, people with long COVID. And
Mhm.
in 6 months, 80% of those people were completely free of symptoms.
Wow.
Yeah. Yeah. Now, my question is, what about that 20%? Like, what's going on with them? And I suspect they weren't looking at the other half of the pathway because when you give a blood thinner, you're not doing anything to help the body break down clot. You're
Right.
simply stopping the body from making more of it. And you rely on the body's own mechanisms, plasminogen activating inhibitor, for example, to kind of grind up those clots and take them out.
Mhm.
But when people have a mutation, say in that protein, they're not going to be able to grind up the clots. And so my suspicion is the 20% of people who didn't get well in that study were people who had issues on the other side of the pathway.
Yeah, they weren't able to excrete that out and maybe have some fibrin issues and things like that, and that wasn't being addressed.
Yeah.
Yeah.
And
Wow,
of
that,
course, COVID makes its own biofilm.
yeah.
There's a whole new arm of research looking at sort of the different proteins that get folded in the body when COVID spike proteins are in there, kind of creating these
Mhm.
almost like little amyloid plaque situations in your blood vessels. So
Mhm.
I do think that people who can't break those down are really at risk for both COVID and the shots. The spike protein comes at you and for both of those, right?
Yeah. Did you use any lumbrokinase or nattokinase in your situation?
So lumbrokinase is what I use. It's my main player. I use the Canada RNA one, which is, I
Mhm.
think, more studied than any of the other ones. And
Yeah.
because of its formulation, it's about 12 times more potent than anything else out there. So
Mhm.
that's what I'm pretty much on for life. I consider that kind of my main game. Yeah.
Mhm. Yeah, I agree. I love lumbrokinase for that. That's really good.
Yeah.
So you recently hosted a retreat around this topic. What were some of your biggest aha moments for the participants as they started unraveling some of these biofilm layers?
Yeah, no, it was so fun. My sister and I host retreats together. She came out from California and did the yoga, and I did the teaching about biofilms
Mhm.
and bladder issues, and it was really fabulous because a lot of these folks are people already in my community. A few of them were new, and so we had this wonderful kind of connection and learning together, and just validation of what it is to live with symptoms that are super inconvenient. Like one of the members even or participants even brought a big bag of like pads and she's like, listen, ladies, this is what I'm going to use to get through the week. If you want to borrow, I'll put my little stash over there. And I think they all went by the end of the week.
Mhm.
So my aha moment was just how powerful it is to be hosting community and facilitating conversations where people really feel seen and heard, and just how important that is, especially post COVID, right? When so many people just really missed that piece of other humans. And yeah, I love being able to help people connect around stuff like that.
That's awesome. So, for people who are listening that have that mystery, quote unquote, bladder issue, frequent UTIs, interstitial cystitis symptoms, or pelvic pain, or bladder spasms, where should they start? And what are the first clues that tell you this is biofilm driven?
So I think it's always a good idea to do a test, to take a microgen test. There's a couple companies out there. I think microgen's the one that I rely on more than any of the others, and it requires, not only doing a very sensitive test like microgen, but breaking down biofilm before you take it. So I always encourage people to take a biofilm breaker like lumbrokinase for 5 days leading up to the test. So you're really grinding into the bladder wall and opening up those biofilms so that when you catch whatever comes out of your bladder, there's something in there. If you don't have bladder biofilm, nothing will come out and you'll have a negative test. And that's usually confirmatory. If you've done a good provoking with Baluch or, lumbrokinase for 5 days and nothing comes out, then I usually say mischief managed. That's great news for you, right?
Mhm.
Um, and most people in my community, when they look, they find something because, not for nothing, but you're in my community for a reason, right? And
Mhm.
so Yeah, and typically then we need to get into the ring with those bladder biofilms, and it doesn't usually take one or two tests. It's many tests because the layers are deep.
Yeah.
I'm working with children too, and even in small kids, if they have the right genetics and if they're living in an environment that kind of can also push them to make more biofilms, like living in mold, for example, is a huge instigator of inflammation and biofilms and also, microclots and fibrin in the body. Then those layers can go deep. And so
Mhm.
we're peeling the layers one at a time and we're treating what comes out and supporting people along the way.
With these microgen tests, can you find biofilms in other parts of the body as well, or is it primarily bladder?
No, you can culture and you can send a microgen PCR for any, secretion you want. So they have a semen test, they have a vaginal test, they have a nasal test. You can send sputum. You can culture out what you can stick the swab in your ear.
Mhm.
There's all sorts of anything that you can put a swab in, you can send in there.
Oh, that's awesome. That's amazing.
Yeah.
So, once you identify the drivers, genetics, environment, stealth infections, what does an effective treatment or reversal process look like for people?
For the bladder in particular? Well, I wish I could say it was herbs or oxidation, which are my favorite things for Lyme.
Mhm.
I just haven't found those to work for the bladder, and so I'm using antibiotics, which
Mhm.
even though I'm a Western trained MD, it was
Yeah.
not my bag of tricks. When I left sort of the matrix medicine model, I really stopped using those things as much as possible, and I've had to come back to them because they really, really work and they're really, really needed. So I love it. If someone else out there is getting results with something other than antibiotics, please contact me and let me know. Because I have plenty of patients who are like, really, another antibiotic? I'm like, I know, but they
Yeah.
work. We also do a really careful job. I work with Ruth Chris on every case, and we do a very careful job in finding the drug that's going to be the least broad spectrum, and that's
Mhm.
really only going to tackle the highest percentage bug there. So Microgen does this really cool thing. It's a PCR, it's next gen sequencing. They're looking at genetics, so you don't have to have it on ice. It can sit on your countertop for a month, and you can still
Mhm.
send it in. Um, and they categorize by percentage, like what's there. And they're not just looking for the 26 or 28 different bacteria that you would get if you were looking at a culture in your doctor's office. They're looking for 57,000 different organisms, fungal and bacterial. Yeah. And
Right.
so this is why I say if there's something there and you've broken down the biofilm, Microgen will find it.
That's really great. That was going to be my question is, does it pick up fungal biofilms as well? So I'm so glad you mentioned that because a lot of times with bladder stuff, it's fungal in that bladder too. And then we're throwing an antibiotic at it and just making it worse if it's fungal in there.
Yeah, yeah. That's they and I recently saw when I had a little Amish girl who came back with 5 different fungal organisms in her bladder
Wow.
and
That's
a whole slurry of bacteria too. Yeah, pretty sick. And that's usually an indication that you're living in mold, honestly, when you
yeah,
have that
yeah.
much fungal overgrowth. Yeah.
Mhm. Now, conventional medicine treats the bladder as a sterile organ and rarely looks at biofilms. Why do we believe that this has been overlooked for so long? And what are they missing?
Dr. Debs,
A loaded question.
one of the many mysteries of medicine. I have no idea why people are like, la, 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 biofilms. I mean, we know. So when I say we know, so when I trained, I trained at Stanford for my medical school. I trained at Lehigh Valley for residency. Great programs. And I learned that, oh yes, biofilms, they exist in catheters of bladders. When people have an indwelling catheter for more than a month and they spike a fever, it's a biofilm, but it's only in the catheter. Really? Why does it stop at the catheter?
Yeah.
Or, now chronic sinusitis, people are recognizing this is a bladder, this is not a bladder, this is a biofilm infection in your sinuses.
Mhm.
But we're really reluctant to kind of admit that that we're teeming with microorganisms, that they might be setting up shop
Yeah.
and for good, right? Like it'd be great if they were in biofilms as opposed to our bloodstream. Like we don't want them in our bloodstream. So thankfully they wall themselves off. But yeah, I think they're everywhere. I mean, they found a microbiome in the brain and the breast and the lung. There's microbiome, there's bugs everywhere. And the question is, are they friend or foe? And
Mhm.
the bladder really shouldn't have anybody in it.
Mhm.
Because think about it, you're flushing it out, 6 times a day.
Mhm.
Most people who can break down biofilm because their clotting genetics are normal and
Mhm.
because they're peeing adequately, will never set up an organism shop in their bladder. Even though things are always crawling up, we're always peeing them out. And then there's the 20% of us.
So you run the Interflow program and a number of healing communities. What tools and teachings have been the most transformational for people going through this journey? And tell us a little bit about the Interflow program too, please.
Okay, maybe I'll start there because honestly, I have to think about the which tools are most transformational. The Interflow program is my newest offering, and we developed it because my team and I were looking around at the patients we had, and so many folks were needing to go down this we call it the microgen journey, like get on the microgen train and just start that process. And there was just a lot of handholding and support, education that they were requiring, and their brains aren't working that great because when you have these infections, you're dealing with like downloads of ammonia from time to time from the bladder organisms. You're dealing with a lot of brain fog, overwhelm. There's just a lot of, how our patients are. They're struggling and they really need a lot of handholding. And so we were providing that, but we kept thinking like, gosh, it would be great to get these guys in community. Like, we can say all we want, like, it's important to check your pH. It's important to like stay on top of the whatever, but it'd be great to have them hear that from one another and to have them also hear sort of that they're not alone. So because we had some experience running communities online, which we started during the pandemic and has been super successful, we said, let's do this. Let's create a little online community of we call them informally, we call them our bladder babes, but like, let's create a community of people who are looking to really heal and get to this deep, deep root that no one else is doing. And that was really the key for me, that nobody else is really doing this. Very few people are doing it or aware of it. I wish that weren't the case. But as it stands now, it's pretty hard to find someone to take this seriously. Most doctors, if you even take a microgen to them, they'll say, oh, there's 10 organisms on here. That's a contamination. That must be
Yeah.
contaminated. Well, yeah, by your biofilms, but they don't
Yeah.
know about biofilms. So they think it just comes from the lab or something.
Mhm.
I don't know. But yeah, basically it was because I felt called to do this service that no one else is providing. And I wanted to do it in a way that was going to be really optimally supportive for people. So we created a membership.
Do you see a difference in men and women? Obviously, women have this problem more than men, but do you see a difference in how many men that have these stealth infections or live in mold compared to women?
It's hard to know really what the sort of prevalence is out there. I will say in terms of who calls our office, 95% women call our office.
Mhm.
And occasionally we've had someone call our office on behalf of a husband or a son. I just saw a woman whose 2-year-old son is in our Bladder Babes community. But typically it's the women who are seeking care around this. And I don't know if that's a function of their having more of the issues. I suspect it is, because
Yeah.
as you said before, so many more women deal with these complex mystery illnesses than men. But there certainly are men who have them.
So you've lived through Lyme, chronic illness, stroke, and now biofilm driven bladder issues, and you've come out stronger. What mind shifts helped you stay resilient through all of these chapters?
I think there have been many. I think the first one I had to really, really accept and lean into and kind of internalize was this idea that I didn't have to do the work that I was doing in order to be of value to the world. I trained in a certain way. I had this beautiful practice. I was working in the inner city. I was working with my best friend. We were seeing really needy people who had no money. And it felt really I felt very sort of service driven and connected to a purpose. And I think the hardest thing in the beginning for me was realizing I can't do that work anymore. That's
Yeah.
not the work that I'm needing to do. And to make a leap into the unknown, it felt like having a baby at 45 and not doing any ultrasounds or any tests and just being like, I'm birthing something here. I don't know what it is. It's me, but who knows what she's going to look like or what this doctor is going to be, peddling in terms of her tools. That was a big leap of faith. And I think letting go of the kind of control of needing to look a certain way and be a certain kind of doctor was a big step for me, my big initial step.
Yeah, that's really hard because you're taught and ingrained in who you're supposed to be as a doctor and what that person's supposed to be, what your persona is supposed to be, and doing a lot of the cling heart work and some of those things. And I'm sure on the days crawling through the floor, you're like, this is not what I was trained to do. If my colleagues could only see me now, they'd commit me, right?
Yeah.
But like you said, just giving that leap of faith and saying, I'm going to turn this over to your higher power and you're going to bring me out on the other side, and trusting that that is a vulnerability for us that is huge. Mhm.
Yeah. And I mean, I'd like to say it's because I'm some sort of strong person, but truthfully, I feel like there was no other choice. Like I
Yeah.
had to surrender because there was the alternative was death or something. I don't know. Like there was no other choice. Couldn't move. I was in so much pain. I couldn't move. Couldn't get out of bed.
Thank you so much for sharing all of this and being vulnerable with our audience. Where can people find you, find your book, your podcast, your programs, if they want to go deeper with you?
Yeah, thanks for asking. So I have a website. It's my name, KristinReihmanMD.com, and all my programs are listed there. I have several, I have a sort of a wellness, I have a online membership for well people who want to stay well and pick my brain every week around sort of healthy holistic tools. It's called The Healing Grove. I have a podcast that people can listen to for free where I interview people like you, and you're going to be on it, right? You're
Yes.
going to be on it soon.
Love to.
So I can share stories of hope and transformational tools with people. I also have a Life After Lyme coaching program, which is kind of the place where I invite people who are dealing with a mystery illness to come get some support, community, and guidance from someone like me, and also just from the other people in the room. There's a lot of wisdom in those groups. And I guess that's the answer I'll share for what you asked earlier. Like, what's the main tool they take away? I think they take away an understanding that community really matters and that they're not alone. I think it can be very lonely to be stuck in to feel stuck in these illnesses, and people need to be reminded that they're human, and that they're worthy of love and acceptance. And I think that's what people get from my community is kind of like that's the common thread.
They definitely need that. Kristen, thank you so much for sharing your powerful story. Your work is so needed, and your ability to weave personal experience and advanced clinical insight is exactly what our community craves. And this kind of conversation helps women finally be seen and heard, which is my motto too, and gives them just the real tools to get their life back. And for everyone listening, if you're struggling with unexplained bladder pain, frequent UTIs, pelvic discomfort, or symptoms that never match your labs because they never quite do, you are not crazy. You are not alone. You need to find the answers. You need to be with community, and there are solutions. And conversations like this is how we bring them forward. So thank you all for tuning in to Let's Talk Wellness Now. I'm your host. And until next time.
Thanks, Dr. Deb.
Thank you. This was awesome. Thank you so much.
You're so welcome. You're such a great interviewer.
Welcome to Let's Talk Wellness Now, where we bring expert insights directly to you. Please note that the views and information shared by our guests are their own and do not necessarily reflect those of Let's Talk Wellness Now, its management, or our partners. Each affiliate, sponsor, and partner is an independent entity with its own perspectives. Today's content is provided for informational and educational purposes only and should not be considered specific advice, whether financial, medical, or legal. While we strive to present accurate and useful information, we cannot guarantee its completeness or relevance to your unique circumstances. We encourage you to consult with a qualified professional to address your individual needs. Your use of information from this broadcast is entirely at your own risk. By continuing to listen, you agree to indemnify and hold Let's Talk Wellness Now and its associates harmless from any claims or damages arising from the use of this content. We may update this disclaimer at any time, and changes will take effect immediately upon posting or broadcast. Thank you for tuning in. We hope you find this episode both insightful and thought-provoking. Listener discretion is advised.